The first test we're going to do is McMurray's test. So first what we're going to do is have AK flex his knee. And then to test the function of the medial meniscus, we're going to externally rotate the tibia slightly. And what we want to do now is allow for extension and flexion of the knee and assess for any pain or popping in the knee joint. So what we're going to do is have him flex, extend. We're going to repeat this a couple of times. Any pain, AK? He's a strong man. So to test the function of the lateral meniscus, what we're going to do is internally rotate the tibia and repeat the same flexion and extension process. So we're going to flex, extend, flex, extend, one more time again. Any pain, AK? No pain. I don't hear any popping. Looks like his meniscus is good. Now we're going to look at the strength of both the ACL and the PCL with the anterior drawer test and the posterior drawer test respectively. We're going to have AK flex his knee. And we want the knee to be in a 90-degree position for these particular tests. And what we'll do first is the anterior drawer test. So what I'm going to do is just palpate for the tibia. And once I've found it, I'm going to move the tibia anteriorly, or try my best to. So it looks like, for me, that was pretty strong. It didn't really feel any motion, any pain on that, AK. We'll now do the same tests on both sides for the posterior cruciate ligament. So this is going to be the posterior drawer test, really. So again, palpate for the tibia. And we're going to push backwards. No real movement. No real movement again on either of those. It's AK's lucky day. I feel like there's no ligament pain. You can probably continue playing basketball, but there are still more tests to come. We're moving the tibia anteriorly, but this time what we're going to do is stabilize the distal femur. We'll have him flex the knee one more time. This time the knee must be in a 30-degree angle, so it's not 90 degrees. So I'm going to make sure that we have the knee in a little bit more of an acute angle position rather than the full 90 degrees. It looks like it's about 30 to me. Then I'm going to stabilize the distal femur with my right hand, and then I'm going to try to move the tibia anteriorly with my other. Palpate for the tibia. There it is. And we're going to try to move it anteriorly. So just going to pull. No movement. And so what we're going to do first is the valgus stress test, which will assess the function of the MCL. And what we're going to want to do is first rotate the tibia externally. So we have him externally rotated here. And then what we're going to want to do is apply pressure to the lateral knee, apply valgus force inward. And we're going to check for any pain or excessive movement of the kneecap. So got him externally rotated, I'm going to apply a valgus force. Looks like it didn't budge very much. AK, any pain?
No.
The man is stoic, no pain whatsoever. We made it to the end of the knee exam. It's the last test we're going to do with AK today, and it's going to be the varus stress test on the lateral collateral ligament this time. AK is in 0 degrees of flexion here. Going to internally rotate the tibia, and then what we're going to do is this time apply a varus stress force on the medial side because we're testing the strength of his lateral collateral ligament. So got the tibia internally rotated, apply force here. Any pain, AK?
No.
No pain. There you have it. That's the end of the knee exam. I think AK is clear, ready to go. Thanks for sticking with us. Hope you learned something today. Nice.